Good day, everyone. Today we will be talking about Asian origin, focusing on Southeast Asia region. Did you know that Asia is the largest continent, full of rich cultures and tradition? And Southeast Asia is especially known for its diverse beliefs and practices. Southeast Asia is consists of 11 countries: Brunei, Cambodia, Indonesia, Laos, Myanmar, the Philippines, Singapore, Thailand, Timor-Leste, and Vietnam. In this presentation, we will share important topics that help us understand Southeast Asian culture better. These include family planning, gender-based preferences, rituals and special observances, marriage and family structure, diet, illness and medications, wellness and disease prevention, hospitalization, organ donation, death and end-of-life practices, and community resources. We are Group 4, and our members is myself, Jessica, along with Happiness, Rian, and Shaira. We hope you enjoy and learn something from our presentation.
My name is Happiness Mustafa, and I'll be talking about the lifespan, beliefs, and practices in Southeast Asia. Across the diverse landscape and cultures in Southeast Asia, the journey of life is marked by a rich mix of belief practices surrounding birth, family planning, gender, and significant life rituals. These customs are deeply rooted in a blend of indigenous traditions, religion, and societal norms that keeps evolving. It continues to shape individual and community life from cradle to the grave. The arrival of a new child in the Southeast Asia region is a very happy occasion, and it is covered by a load of rituals and belief aimed at ensuring the well-being of the newborn child and the mother. Family planning, however, presents a more complex picture because traditions, values, religion, doctrines, and modern healthcare often intersect. For prenatal practices across the region, expectant mothers often adhere to specific dietary and behavioral restrictions. In traditional Vietnamese belief, pregnancy is considered a hot state and certain foods are avoided to maintain the balance. Many cultures also discourage pregnant women from attending funerals to avoid exposure to negative spirits. During and after birth, traditional birthing practices, often facilitated by a village midwife, are still prevalent in many rural areas. Following the birth of the new child, a period of confinement for the new mother is a very common practice. In Thailand, a practice called Ufai involves the mother laying by a fire to ensure the uterus contracts and to ward off illness of any kind. The birth of a child is often celebrated with specific ceremonies. In Bali, Indonesia to be precise, the Tulubalani ceremony is performed when a baby is 3 months old, marking the time when the baby is believed to have a firm connection to its soul. The concept of family planning in Southeast Asia is marked by a variety of factors, including religious beliefs and socio-economic factors. For the religious and cultural beliefs, according to research, women in Indonesia face significant societal pressure to become mothers, a value which can influence the reproductive health choices. In a study on contraceptives used in that region, it was discovered that cultural and religious factors, alongside a sprinkle of fear of side effects, are major influences on a woman's decision making. Modernization and changing attitudes. Urbanization and increased access to education is leading to a shift in family planning practices. However, traditional beliefs and misinformation can still be a significant barrier to the uptake of modern methods in many communities. Gender-based preferences. The preference for sons has historically been a significant cultural feature in many parts of the Southeast Asia. It is rooted in the patriarchy system, which is believed that sons would carry on the family name and care for the parents at old age. While this preference still exists, there is a noticeable shift that is occurring across the region. As women are gaining more access to education, getting jobs, their economical value in the society and in their family is increasing, and this is helping to balance out the traditional gender preference in that region. Changing family structures. As mentioned earlier, with daughters gaining more education and getting jobs, daughters are now seen as a more reliable caregiver for their aging parents and this is contributing to a greater appreciation for female children. In some societies, there is a more fluid understanding of gender than in many Western societies. For example, Thailand's social acceptance of the term lady boys, which is a person who is a transgender, is now reflecting a complex and nuanced cultural landscape regarding gender identity. Rituals and special observance. Life in Southeast Asia is covered by a series of rituals and special observance that marks significant transitions from coming of age to the end of life. These ceremonies often serve as reinforcing cultural values, strengthening the community bonds, and providing a sense of spiritual continuity. Coming of age rituals vary wildly across the Southeast Asia region. In Bali, the Mempadis or tooth filing ceremony is a significant rite of passage for adolescents, symbolizing the taming of human passions and the transition to adulthood. In Malaysia, Muslim boys undergo circumcision, which is both a religious obligation and a cultural marker of their transition to manhood. These ceremonies are rich in symbolism and signify the individual's new responsibilities and their integration into adult society. With death and funeral rites, the end of life is met with a profound sense of ceremony and respect throughout the Southeast Asia region. In Buddhist majority countries like Thailand and Cambodia, funerals are elaborate affairs and can last on for several days. Key rituals include bathing of the deceased body and daily chanting by monks to help guide the spirit into the afterlife. The belief in reincarnation is central, and rituals are designed to ensure a favorable rebirth. In Cambodia, it is traditional to fly a white crocodile shaped flag to announce the death of an individual. Across many cultures, including Vietnam, funeral rites are not only about mourning but also ensuring that the deceased transitions peacefully into the afterlife to help maintain a special connection with them as their ancestors. These practices often blend major religion like Buddhism with local folk traditions. I will now hand over to Renee to cover beliefs and practices. Thank you.
Hey everyone, my name is Rian. Today I'm going to talk about cultural practices in Southeast Asia, specifically around marriage and family, food, and how people deal with illness and medicine. First, let's start with the Philippines. Families are super close here, usually big and very connected. Marriage is often influenced by religion, especially Catholic. And when it comes to food, rice is a must. Meals are usually shared and there's always something festive for health stuff. Some still go to traditional healers called albulario, but people also go to regular doctors and hospitals. Next is Indonesia. Family and religion, mainly Islam, play a huge role in marriage and everyone's life. Food is spicy and flavorful, and they love sambal. Halal food is a must. For health, a lot of people drink jamu, which is a traditional herbal medicine, but modern medicine is also used. Next one is Malaysia. Malaysia is kind of similar. Marriage often includes dowries and traditional Islamic costumes. Food is rich, spicy, and usually halal. They use a mix of traditional remedies, Chinese medicines, and Western healthcare. The next one is Singapore. Singapore is very cultural, so family setups can be a mix. Some are more traditions, others are modern. Their food is super diverse too: Chinese, Indian, Malay, you name it. Most people trust Western medicine, but some still use traditional Chinese or Indian healing methods. The next one is Thailand. Thailand is all about respect for elders and Buddhist traditions. Marriage often includes blessing at temples. Thai food is amazing. It's all about balancing flavors. For health, people turn to herbal medicine, massage therapy, and Buddhist healing. Next is Vietnam. In Vietnam, Confucian values are big, so honoring your family and ancestor is a big deal. Food is very fresh with lots of herbs, and they believe food itself can be healing. They use both traditional medicine and modern hospital. The next is Cambodia. Cambodia also values family approval in marriage, and Buddhism influence their way of life. Their meals often include rice, fish, and fermented stuff like prahok. Healing includes traditional healers, spiritual rituals, and regular healthcare. The next is Laos. Laos is all about extended family and Buddhist traditions. They eat sticky rice with herbs and fish, and meals are shared. For sickness, people often use herbal remedies and spiritual practices, especially in the countryside. Next is Myanmar. Myanmar follows a similar path. Buddhism influenced family life, and arranged marriage still happen in some areas. Their food mixes Indian and Chinese flavors. When sick, people might see traditional healers or use astrology, but hospitals are also available. In Brunei, Brunei is a very Islamic, so marriage follows Sharia law, and polygamy is allowed. Food is strictly halal, no alcohol. For healing, they use Islamic practices and also go to modern doctors. Lastly is Timor Leste, a strong traditional costume like bride wealth in marriage. Their food has a mix of local and Portuguese influence. When it comes to health, spiritual healing is still common, but public healthcare is growing. Every country is every country is different, but you'll notice that family tradition and food really bring people together. And when it comes to health, there's this interesting of mix of old school remedies and modern medicine. Next presenter is Jessica.
Today, I will share about wellness and disease prevention in Southeast Asia. We will talk about traditional health practices and explain how we PSW can support this safely and respectfully. In Southeast Asia, many people use herbal and traditional medicine to stay healthy and to prevent diseases. They often use herbs like turmeric and ginger and drink medicinal soups to boost their health. Massage therapies like Thai massage help improve blood flow and help people relax. Meditation and prayer are also important because they help people feel calm and support their mental and spiritual health. A study showed that about 32% of Thai workers use traditional medicine, especially if they have long term conditions like diabetes or liver disease. It's important to remember that herbal medicine can sometimes interact with other medications, so we need to make sure it's safe. Community programs in Southeast Asia also teach people about healthy food, hygiene, and vaccines to help prevent diseases. As healthcare workers, there are many ways we can help our clients. First, we should always ask them if they use any herbal or traditional medicine. We need to educate them about using this safely and talk about possible risks if they take other medicines. It's also very important to support their spiritual and meditation practices because this helps them feel respected and comfortable. We should give them the health materials that are easy to understand and fit their culture. There are also great community resources to help. The Thai Traditional Medical Innovation Center offers personalized health checks and helps clients safely use traditional therapies together with modern care. The Health Sciences Authority Singapore, through ASEAN collaboration, gives safety standards and guidance to help people make safe and informed choices about traditional and complementary health products. The Samaya TropMed Network supports training for healthcare workers, promotes safe use of traditional medicines, and runs community health programs across Southeast Asia. Now let's talk about hospitalization, including surgeries and transfusions. In Southeast Asia, many hospitals face big challenges. One of the biggest problems is not having enough blood, and not everyone can easily access surgeries. Blood transfusions are very important. They help patients after accidents, during childbirth, and when they have serious anemia. But in some places, cultural and religious beliefs makes people afraid to receive blood or surgery. That's why countries in this region are working hard to encourage more people to give blood safely and to support patients better. Many countries like Thailand and Indonesia have national programs to collect blood safely and avoid relying on family members for donations. Another big issue is preoperative anemia. This means having low blood levels before surgery. A study showed that patients with anemia have higher risk of dying and staying longer in the hospital after surgery. If we check and treat anemia early, patients will need fewer transfusions and recover faster. International groups also provides guidelines and training to make surgeries and blood transfusion safer. As a PSW or nurses, we can do a lot to help. Before surgery, we should check if the patient has anemia and supports them to get treatment like iron supplements if needed. During blood transfusions, we need to monitor the patient's vital signs closely and watch for any bad reactions such as fever, breathing problems, or swelling. It is also very important to explain these procedures clearly to the patients and their families so they will feel safe and understand why these steps are necessary. There are some great community resources that help support safe surgeries and blood transfusion. One is Thai Red Cross National Blood Center. Supplies safe blood and support hospitals. The World Health Organization also helps countries like Timor-Leste build better blood system and train health workers. Another group is the International Society of Blood Transfusions, offer guidelines and technical support to many Southeast Asian countries. These resources make hospital care safer and more effective to everyone. By working together, supporting community programs, and using proper nursing intervention, we can help improve patient safety and health outcomes in Southeast Asia. And lastly, I'll talk about organ donation in Southeast Asia. Why donation rates are low and how we can help. Organ donation means giving organs to save or help someone's life. In Southeast Asia, there are only about 3.8 donors per million people. This is very low because of the strong cultural and religious beliefs and lack of information. Many people believe they need to keep their body whole even after death. Some are afraid it affects the soul's journey. Families often decide together and sometimes say no, even if the person wanted to donate. As PSWs and nurses, we can help by giving clear information and supporting families emotionally. We can also work with community and religious leaders. It is important to talk early about organ donation and record the patient wishes. These are the groups that helps. Odisseia trains healthcare workers in Southeast Asia to improve knowledge and make organ donation systems stronger. And the National Kidney Foundation in Singapore educates the public, does talks and events, and support patients and families to feel confident and safe. To summarize, organ donation rates are low because of cultural and religious reasons. Community groups like Odisseia and NKF help people learn and feel supported. Nurses and PSWs have a big role in guiding families and encouraging and understanding. Thank you for listening, and our next presenter is Shaira.
Hi, I'm Shaira, and I'm going to talk about the death and end of life practices and community resources. So, first is death and end of life practices in Southeast Asia. So, Southeast Asia includes countries like the Philippines, Vietnam, Thailand, Indonesia, Malaysia, Cambodia, and etc. So, each has diverse religious and cultural influences such as Buddhism, Islam, Christianity, indigenous beliefs. Despite differences, many share values of respect for elders, family-centered care, and spiritual beliefs during end of life. So these are the key practices and beliefs. So we have here the country, religion, and culture, and common practices at end of life. So first is Philippines. The religion is Catholic or Christian. So their common practices is prayers like rosary, confession, anointing of the sick, novena after death, and family gathers at bedside. So second is Vietnam. Their religion is Buddhist or ancestor worship. So their common practices is family may chant, burn incense, avoid excessive crying to let soul pass peacefully, and bodies not move for hours. So next is Thailand. which is Buddhist. Monks may chant at bedside. Calm and dignity are important. Family may meditate together. So next is Indonesia, Muslim. So body wash, wrapped in white cloth, buried within 24 hours. Dying person is encouraged to say Shahada. So the last one is Cambodia. Their religion is Theravada Buddhist. So their common practices is avoid disturbing the dying. Prayers and chants help the soul reach a good reward. So for PSW or nursing interventions, to respect religious rituals and offer privacy for spiritual care, encourage family involvement and support cultural mourning process, avoid forcing procedures if the family prefers a natural death process. Next is use non-verbal support when language barriers are present. Last is ask the client or family if they wish to have a spiritual leader visit. So for the important concepts, cultural sensitivity, Southeast Asians may avoid talking directly about death. Next is collectivist mindsets. Families make decisions together, not just the patient. So spiritual meaning. So illness and death may be seen as karma, fate, or God's will. So the second one that I'm going to talk to you is the community resources. So as a PSW, it's important to know which resources you can recommend to Southeast Asian clients in Canada during palliative or end-of-life care. So these are the resources and their description. So first is Hospice Palliative Care Ontario. They offer culturally sensitive palliative services and home care. Next is Filipino Center Toronto. They assist Filipino seniors and families with healthcare support. Third is Yehong Center for Geriatric Care, multicultural long-term care, including services in Chinese, Vietnamese, and other Asian language. Next is multicultural hospice programs like Circle of Care. They provide home support, grief counseling, and interpreter services. Last one is places of worship. Churches, mosques, temples can provide comfort, spiritual guidance, and community. So for PSW or nursing interventions, so first is refer families to cultural specific organization for grief support and translation services. So next is connect clients with faith-based counselors or chaplains. Then provide printed materials or explanations in the client's language. Finally, respect the client's desire for home care versus institutional care.